We have 33, I believe, co-sponsors on a piece of legislation that would try to break the back of the pricing monopoly that exists with the pharmaceutical industry for prescription drugs in our country. The fact is, the American consumers are charged the highest prices for prescription drugs anywhere in the world. The highest prices for prescription drugs to the American consumer. And it's not right, it's not fair, and it ought to stop. We do have price controls on prescription drugs in our country. It's just controlled by the pharmaceutical industry. That's why we have the highest prices in the world. Now, Mr. President, let me by consent ask to show a couple of bottles of medicine.
Without objection.
Mr. President, these two bottles of medicine are Lipitor. Lipitor is a very common prescription drug used by many Americans to reduce cholesterol. As you can see, Lipitor, this is made in Ireland, as a matter of fact, and then imported into this country by the pharmaceutical industry. From Ireland, it is sent many places, but in this case, the bottle in my left hand was sent to Canada. The bottle in my right hand was sent to the United States. Same bottle, same pill, slightly different color on the front of it. FDA-approved medicine, produced in an FDA-approved plant in Ireland, sent to Canada and the United States. The difference? Well, no difference. Same plastic in the bottle, same medicine inside, except the price. The Canadian pays $1.83 per tablet, and the American pays $3.57, 96% more. Let me say that again. No difference, same medicine, same bottle, same price, made in the same plant, FDA-approved. Difference? The American consumer is told, guess what? We've got a special deal for you. You get to pay 96% more for the same medicine. Now, is this unusual? No, it's not. I sat on a hay bale one day at a farm with an old codger. He was in his 80s. And he said to me, this is in North Dakota, he said, you know, my wife has been fighting breast cancer. And he said, she's fought this now for 3 years. And we've gone to Canada. We've had to go to Canada to get the medicine, to buy tamoxifen. And the reason we've had to drive to Canada every 3 months or so to get the medicine is because we save 80% on that medicine by buying it in Canada. We can't afford to pay the price in the United States. We can't afford to pay the price that is required to have my wife fight this breast cancer. Question is it just Canada? No, not at all. But let me at least describe the situation with the U.S. and Canada. I could put up this chart with Italy, Spain, Germany, France, England. I could put up this chart with virtually every other country because the U.S. pays the highest prices. The U.S. consumer pays the highest prices in the world. Lipitor, I just described it. Plavix, we pay 46% more. Prevacid, we pay 97% more. Zocor, 31% more. Nexium, 55% more. Zoloft, 52% more. I mean, the list goes on, as you might imagine. We have a population that receives a lot of benefit from miracle drugs. There are prescription drugs that allow you to manage your disease without having to go to an acute care bed in a hospital. It's a wonderful thing. A substantial portion of the research to develop those drugs is done in the National Institutes of Health, paid for by us. We turn that research over to the prescription drug industry. They produce medicine from it, and then they sell us the medicine. Another body of research is done by the prescription drug industry themselves. They spend a lot of money on that. They also spend a lot of money on advertising and promotion. Now, anyone who is standing in front of a mirror this morning, brushing their teeth, or perhaps shaving, getting ready for work, and had their television on it, they have one of those little television sets. Anyone who was engaged this morning doing that probably saw a television commercial. And it said this: you should go ask your doctor whether the purple pill is right for you. Didn't necessarily tell you what the purple pill was for. It just says you need to be talking to your doctor to see whether you should have a purple pill. It almost makes you want to run out and say, hey, what's this purple thing? Maybe I should have some of these purple pills without knowing what it's for. It goes on all day, every day, advertising direct to consumers for medicine that can only be prescribed by a doctor with a prescription, saying, go talk to your doctor. Wouldn't you like some of these pills? We have an unbelievable amount of promotion and advertising with respect to prescription drugs. That's another issue. I believe there's only one other industrialized country that allows that, and it's New Zealand. But that's another issue for another time. The issue is pricing. And I've described what's happening here with respect to pricing. This is Canada, but I could describe it for other countries as well. The percent of adults aged 19 to 64 reporting not filling a prescription because of cost, 43% of the uninsured in this country, that's 45, 46 million people, do not take their medicine because they don't have the money. They say it costs too much. The result, well, often many of them will end up in the priciest kind of health care, some kind of an acute care bed through an emergency room in a hospital.